Hello, this is Samantha Yala, and I did my presentation on Addison's disease. Now, I couldn't quite figure out how to record myself and record the presentation at the same time, so I'm just going to apologize in advance for that, because that's how I was going to do it, but I just couldn't figure it out. So basically, Addison's disease is also known as the primary failure adrenocortical insufficiency, chronic adrenocortical insufficiency, and primary adrenal insufficiency. Addison's disease is a rare and serious adrenal gland disorder that causes a deficiency in the production of cortisol and aldosterone. The adrenal glands are part of the endocrine system, and they are responsible for the production of hormones of the body vital to daily function, such as adrenaline and testosterone. So the adrenal glands are the structures that sit right above the kidneys, and Addison's disease hinders their ability to produce the sufficient amount of cortisol and aldosterone. Cortisol is the hormone that helps the body respond to stress, whether that be injury, illness, or surgery-wise. It maintains the blood pressure, heart function, immune system, and blood glucose levels. And aldosterone is the hormone that balances sodium and potassium in the blood. It controls the amount of fluid in the kidneys that the kidneys remove as urine, and it affects the blood volume and pressure. As I said previously, Addison's disease is rare, with only 1 in 100,000 people having it in the US, and it affects both genders equally. There are cases in all age groups, yet it is most common in the range of 30 to 50-year-olds. It is mainly caused by an autoimmune disease, which is when the body's own immune system attacks its own tissues and organs, and then it attacks the outer portion of the adrenal glands, called the cortex, so right here. And once that is no longer functioning correctly, it hinders the ability for the adrenal glands to produce the hormones that it needs to. So other causes may be injury to the adrenal glands, infections resultant of tuberculosis, HIV or AIDS, and fungal infections, cancer cells that metastasized and invaded the adrenal glands, bleeding in the adrenal glands, and the surgical removal of the adrenal glands. And the adrenal glands are only removed when there is a mass or a tumor, and that increases the hormone production, leading to an adrenalectomy. There are various symptoms, and they are very general, which is why it takes many tries to diagnose it. And they are really slow appearing, and that is due to the symptoms only manifesting themselves when 90% of the adrenal gland is damaged. So the symptoms are progressive over time, and they are slow and gradual. And then the symptoms include abdominal pain, abnormal menstrual periods, craving salty foods, dehydration, diarrhea, irritability, lightheadedness, dizziness when standing up, the loss of appetite, low blood glucose, low blood pressure, which is also known as hypotension, muscle weakness, nausea. And then you get patches of dark skin that surround scars, skin folds, or your joints. You are sensitive to cold, unexplained weight loss, vomiting, worsening fatigue, and the symptoms can get worse and become an Addisonian crisis, which is a medical emergency, and it is often resultant of an injury or an illness or even just intense stress, and if it's left untreated, it may cause shock and even death. And the symptoms of that is restlessness, confusion, you are suddenly afraid, and other mental changes, dehydration, extreme weakness, trouble staying awake, loss of conscious, a high fever, lightheadedness when you feel faint, paleness, severe vomiting or diarrhea, and deep pain in the lower back, your belly, or your lungs. Okay, so diagnosis and testing consists of history and physical, which is when your doctor will review your symptoms and conduct a physical examination. And such physical evidence of Addison's disease, again, are the dark patches of skin. So that may be an indicator to you as to you having Addison's disease. A blood test will measure the levels of sodium, potassium, and cortisol and Addison in the blood. And then there's the ACTH stimulation test, and it tests the adrenal response when it is given a shot of artificial ACTH. And if there is a low production levels of cortisol in response to that, that indicates that there's a problem with the function of the adrenal glands. X-rays are also used, and they look for calcium deposits on the adrenal glands. And then a more specialized form of X-rays would be a computed tomography, also known as a CT scan, and it computes and combines the X-rays into forming a cross-sectional view, and then they later evaluate the adrenal and other glands, and they could see if the immune system has caused damage to the adrenal glands or if there is any proof of infections. Treatment-wise, doctors often prescribe hormones similar to those that are made by adrenal glands, and they replace the deficit hormones. So like a hydrocortisone pill will replace cortisol, or a fludrocortisone acetate pill will replace aldosterone. And then it is also recommended that people with Addison's disease have increased the intake of salt in their diets, especially when they're in hot and humid weather or when they vigorously exercise. And when they do fall into an Addison shock, they have to inject intravenous medicine. And people with Addison's disease are medicated for the rest of their life, yet that doesn't hinder them from living a normal, healthy life. Though they are recommended to wear an ID, and they're suggested to let medical personnel that they have Addison's disease, and they are also recommended to have injections of cortisol for emergencies and have people that know how to inject them with it if an emergency faces them. And those are my references, and that's all I have. Thank you so much.